The triceps muscle is a workhorse muscle, and as I said before, triceps means three heads. So the first head is this here, which attaches to the humerus, and it's quite a broad attachment. This is a big, strong muscle. The second head is lower down and is covered, so you can't really see it in this picture, but it's tucked in underneath here. And the third head is this one, which runs up and attaches into the scapula or the shoulder blade. When the third head contracts, it will exert a force on the shoulder joint and it will stop the joint from being pulled downwards. Therefore, it's quite an important stabilizer of the shoulder joint during forceful movements. All the three heads join together, and then they become a tendon which joins into the olecranon process, and that's the point of your elbow. So the primary movement of this muscle, when this muscle contracts, it will straighten the arm out. And as I said in my explanation earlier, it is a muscle which is used during hammering, during push-ups, during anything where there's forceful straightening of your elbow, straightening of your arm. This is when the triceps muscle is turned on and has to work. There are 5 sets of trigger points, and the most common occur in the third head. And that's not surprising, because this is the head which works across both joints, and so that makes it the most vulnerable. The pain that you feel from this is a pain that you feel comes up over the back of the shoulder joint, and it may also radiate down here, which is on the outside of the elbow, which is really where tennis elbow is, the common diagnosis of tennis elbow is located. So this is one of the other causes of tennis elbow. Most people would look just at the point and they would say, aha, you've got damage to the tendon coming into this area, which comes from a tendon by the long name of extensor carpi radialis brevis, and then they would do something to it, acupuncture, injection of cortisone, and so on. And then it doesn't get better. And if it doesn't get better, well, there are other triggers and there are other causes of pain in this area, and one of them is the trigger points in the third head of the triceps muscle. The second trigger point occurs here, which is in the head attaching to the humerus. The pain from this tends to be much more local, so it is over where the trigger is. It may also occur over the back of the elbow. So that's the pattern of the second set of trigger points. The third trigger point occurs much lower down the arm, close to where the third head arises. This will send pain again to this area here. So now you can see there are 2 sets of trigger points which refer pain to this area, which is the so-called tennis elbow point. The fourth trigger point occurs lower down at the back of the arm and refers pain back to the back of the elbow. And the fifth trigger point is right at the insertion here. There's a little muscle called the anconeus, which is really part of the triceps, and it refers pain slightly lower down here. So this looks a complicated picture, but the first set of trigger points refers high and out to the side. The third set of trigger points down here refer to the side. The second, the fourth, and the fifth refer to the back of the elbow and locally.